This is not medieval torture. This is the current method used in today's hospitals for neck traction. If you were in my position, would you be scared?
Not long ago, I was on a hospital bed suffering from complications of a misdiagnosis. I wouldn't wish that experience upon anyone. And to make any sort of improvement in the medical industry, it takes a team of dedicated professionals. And together we are ModO, and we modernize medical practices. Let me introduce you to our team. This is Caleb Boast, a mechanical engineer from Boston, Massachusetts, and he knows how to kick ass.
Next up on our team, we have the big dog, Braden Dustin. Braden is currently working in the medical industry as a design and development engineer and is a crucial part of our team here at ModO.
And finally, we have the man with the vision, Sterling Everett, a software and mechanical engineer.
At ModO, we believe in a future that promotes safety and efficiency for surgeons and patients alike. You wouldn't want to go into a surgery with any fear for what's happening behind those closed doors. Current practices to achieve neck traction during invasive surgical procedures don't just look scary, they're unsafe. 52% of all major neck surgeries result in minor or major complications, due in part to the current method, a weight and pulley system attached to the patient's head.
In many cases, revision surgeries are required to correct these complications. This is money that the hospital loses regularly. These complications cost anywhere from $4,000 to $150,000 per complication.
Let me introduce you to the Spinal Tuner, the modern orthopedic solution to give surgeons the precision they need and patients the safety they expect.
The Spinal Tuner uses linear actuators to apply force on a patient's skull to provide spacing during neck surgery. The device provides instant force feedback to alert surgeons if there is creep, holds the position, and stabilizes the head of the patient in place. The Spinal Tuner comes with adaptable plates to fit most hospital beds and is very light to carry around, weighing in at 15 pounds. In the event of a power outage, the device will lock in place, preventing any undesired movement, and it also comes with a backup battery to help release a patient and to reset the system if needed. With a surgical device becoming 5 to 10 times more accurate, surgeons will no longer have to approximate 5 to 10 pound weights in a bucket or bag to perform such a delicate surgery.
Utah, the home of a tightly knit and renowned medical community to integrate us into the market. As our device becomes the local industry standard, surgeon use and word of mouth will propel us into a national market.
Currently, there are 2 doctors working with us to develop this device and implement it for medical use. This gives us the opportunity to expand to 340 hospitals in Utah alone, with direct integration starting in the Salt Lake Valley. This process of integration has opportunities for immense growth within the medical world, as this can become a new standard for anterior cervical discectomies and similar surgical procedures.
Hospitals everywhere need a better alternative for neck traction surgery, and we are here to provide that solution.
We are currently seeking $50,000 for product development and for preparation for FDA submission, in exchange for 20% ownership stake in ModO.
This has an anticipated return on investment of $5 million in 5 to 7 years, following FDA approval of our device.
Utah is just the beginning for the Spinal Tuner, as we envision taking this to the global market. Efficiency,
Safety.
Precision.
we are ModO. Join us to modernize medical practices.